Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of May 20th, 2024. As health professionals rooted in Oakland, serving some of the most vulnerable populations in the Bay Area, we are here to cut through the noise and bring you the latest information on health and issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, after an update on COVID, H5N1, and Mpox, you'll hear from my co-host, Vanessa Reeves, who will talk about diabetes. Starting off with COVID in the wastewater nationally, it's currently considered minimal. This is taking a look at the past 1 year, and we can see that overall it's about where we were this time last year. And we can see a very slight uptick there most recently over to the far right. And if we hone in on the past 45 days, you can see this very slight uptick for the national average. Here we can see it broken down by region, and we can see that the Western region, which is in that darker teal color, was the lowest, but most recently it is heading up and has actually crossed over the other regions and is now the highest. And just taking a look at the West on its own, we can indeed see that recent uptick. So once again, all things considered, we are still low or minimal, but we seem to be already in an upswing, at least in the Western region, which we know is typically later going to be followed by increases in cases. And if you're trying to use wastewater resources to understand what's going on around you, you've really got to find a watershed or a wastewater site near you, and the resources and links to that are in the post. And now taking a look at the new voluntary hospital reporting in the National Healthcare Safety Network. Last week was the first week to report on this because hospital reporting became voluntary on May 1st. And last week when I reported, almost 5,000 hospitals, or 91% of hospitals, were providing their data. And it seems like those were just stragglers still coming in, maybe from when it was required, because this week it looks like more than half of those have now dropped off. So we've only got 43% of hospitals reporting. So for the time being, it does seem like this is going to be a bit of a blind spot in terms of the public being able to keep an eye on this. But we'll wait and see how states emerge in this. But right now, this pretty much leaves wastewater and death as the two most reliable indicators to see where we are. And taking a look at deaths, we know it's reliable, but it's a very late indicator. So by the time we see deaths going up, this will be several weeks after increases in cases and hospitalizations. So this is more looking back. So a month ago, the week ending April 20th, there were 443 deaths in the US from COVID. This is down from 532 deaths from the week before. So we're finally under 500 deaths in a week in the United States from COVID. So glad to see it heading in this direction. But we still need to be doing better than this because we are in a lull, and yet it still dwarfs the number of deaths that we're seeing from all the respiratory infections put together. So flu, RSV, and everything else. So we need to have appropriate effort and concern about this many deaths every week from a pathogen that is spread through airborne particles. And we should be doing what we can to decrease transmission, to make sure that those who are vulnerable stay up to date on their vaccination, and that those at risk of a poor outcome get timely treatment. So those should be our goals. As for SARS-CoV-2 variants, this is the same slide as I showed last week because it's only updated by the CDC every other week. As a reminder, it's JN.1 and its descendant, KP.2, which are dominant. KP.2 is on the rise. And remember, KP.2 has some unique mutations, which are being called flirt mutations, and we're still waiting to see whether the new 2024-25 COVID vaccine is going to target variants with the flirt mutations or not. I thought I was going to be able to update on this decision today because the FDA's advisory committee was scheduled to meet to discuss it on May 16th. However, they postponed that meeting and announced on their Twitter page that they will instead meet on June 5th to discuss and make recommendations on the strain or strains that will be included in the fall formula. So that's a few more weeks before we will have this information, but hopefully this is being done to allow time to select the most appropriate formulation, not only based upon what we're seeing in this moment, but perhaps based on projections of what we think is coming. So we will report more as we have it. And briefly to update on H5N1, I reported last week about the CDC's wastewater surveillance going to be put up, and that dashboard is already up. So far, what we have is a dashboard that is looking at influenza A. So this will include the subtype of H5N1, but it's all lumped together. So at this point, we don't know specifically what we're looking at. But having said this, this is normally a relatively low time of influenza A because we're not in flu season. And so this monitoring is going to give public health officials an indication of where they may need to look further and do further testing. So taking a look at influenza A in the wastewater, where the darker purple is going to indicate higher levels and the darker greens are the lower levels. The sites with the highest levels are in locations in Kansas, Texas, and California, in that order. And one thing to note is that this wastewater testing also cannot distinguish where the influenza A virus is coming from. So it could be from humans, it could be from birds, it could even be from discarded milk from infected cows, or some combination of all of the above. So I'm glad to see this infrastructure being used and that it can give us some indications of where to look next. And the dashboard does mention that monitoring efforts are likely to continue to evolve and to be refined. So the link to this is in the post in case you're interested, but really the bottom line at this point regarding H5N1 is that the main things to do are pretty simple. Don't consume raw milk or products made from raw milk. They're not pasteurized, so they haven't killed not only H5N1, but a number of other things that can make humans sick. And don't touch wild birds, don't touch any dead animals, cook your meats thoroughly. And if you are someone who works closely with animals, monitor the CDC guidance and your industry standards as those are evolving. And now briefly on Mpox, it is still at low levels here in the United States, which is good. However, last week there was a morbidity and mortality weekly report regarding the threat that is posed by increasing Mpox cases in the Democratic Republic of the Congo, which I've reported on before, but it's continuing to cause problems there and is now thought to pose a threat to the US and globally. And the real concern here is that this outbreak is the clade 1 Mpox, which is much more severe than clade 2, which is what caused the global outbreak that we had in 2022. So clade 1 is severe right now in the Democratic Republic of Congo, but it's increasing and it's resulting in more severe illness and a higher mortality rate. So the main thing here is that if you are at higher risk, please get the vaccine, the 2-dose Jynneos vaccine series, if you are in one of these priority populations. And now we're going to turn to diabetes. So we know that diabetes is a major global and national concern. It actually affects an estimated over 500 million people. So over 500 million people worldwide have diabetes. In some places, the incidence is as high as 10%, 1 in 10 people. and that gets higher in the older age groups. Millions die from it every single year. And even though this is largely preventable and can even be reversible, new diagnoses of diabetes, as well as the overall number of people living with diabetes, has been going up for decades, and it's projected to continue going up. Diabetes is a major cause of blindness, of kidney failure, folks on dialysis, strokes and heart attacks, as well as amputation of the lower limbs. Sometimes the symptoms of diabetes can come on suddenly, but in the case of type 2 diabetes, it often can start off mild and could take months or even longer before it's diagnosed. But we really want to know as soon as possible, the sooner the better, if someone has diabetes or prediabetes, so that we can intervene. And those interventions are everything from lifestyle, diet, exercise, weight loss, and medications. The usual symptoms when diabetes first starts, so the presenting symptoms are feeling very thirsty, urinating more than usual, blurry vision, unintentionally losing weight, and fatigue. Now, from the earliest days of the pandemic, we knew that people with diabetes were at higher risk of doing poorly with COVID. And that was something we understood from the very start. It wasn't really a surprise. We know that diabetes makes people more susceptible to doing poorly with a number of different infections, flu, pneumonia, and so on. And very quickly, we saw that this was the case with COVID as well. And then not too long after that, we learned that getting COVID could in turn worsen a person's diabetes. So it could become harder to manage diabetes after a COVID infection, even after the acute phase is over and a person had recovered. And then a little bit after that, we learned that COVID could actually cause the new onset of diabetes. And I went over all of this as well as supporting research in a prior briefing, which is linked in the post, along with those articles that discuss these findings. But all of this was, of course, very unwelcome news because, like I started with, we already have very high and increasing burden of diabetes. So to have a pandemic that's affecting so many people actually worsening diabetes and even causing diabetes was just more bad news. So we see that it is definitely complicated and at least a two-way street between COVID and diabetes, with COVID making diabetes worse, diabetes making COVID outcomes worse. So they're compounding each other. And this is what is often referred to as a syndemic status. So syndemic refers to two different epidemics, or a pandemic and an epidemic in this case, that occur simultaneously and amplify each other or aggravate each other. And that is the situation with COVID and diabetes. I am now going to pass it over to Vanessa to provide us with some very important and timely information on diabetes.
Hello, I'm Vanessa Reeves, and a Senior Clinical Program Coordinator here at Reeves Community Health Center for Diabetes Management and Substance Use Programs. Thank you, Dr. Noha, for allowing me to be a co-host on the Public Health Briefing. Today, I'll be discussing some recent studies on diabetes, long COVID, and fruit and vegetable intake, but I'll also talk about a program that is funded by the state that will allow CalFresh users to get more bang for their buck at farmers markets. So to begin, diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. So insulin is a hormone made by the pancreas that helps glucose get into your cells to be used for energy. So in diabetes, this results in high blood sugar levels because glucose then stays in your blood and doesn't reach your cells. So there are four main types of diabetes: type 1, type 2, prediabetes, and gestational diabetes. So for the purpose of this presentation, I will be focusing on type 2 diabetes, which is when the pancreas either cannot make enough insulin or cannot effectively use the insulin it produces. So type 2 is the most common diagnosis among all forms. So about 90 to 95% of people diagnosed with diabetes have type 2. However, type 2 can be prevented by engaging in healthy behaviors like nutritious eating, physical activity, and weight management. And to determine if an individual does have diabetes, a simple blood test known as the hemoglobin A1C can be done. So the hemoglobin A1C measures your average blood sugar over the last 3 months. And here listed are some ranges determining your possibility of diabetes. So normal range is anything less than 5.7. Prediabetes is 5.7 to 6.4, and diabetes is 6.5 and above. So currently 10 to 40% of people who are infected with SARS-CoV-2 suffer from symptoms of long COVID, which are experienced 3 to 12 months after recovery from the acute phase of COVID-19. So the presence of diabetes may influence long COVID, and studies shown that people with metabolic diseases like diabetes have a higher risk of developing long COVID symptoms like fatigue, tachycardia, microvascular dysfunction, compared to people without diabetes. So there was a study that evaluated the effects of COVID infection in patients with type 2 diabetes compared to patients with type 2 who did not contract COVID-19. So a total of 108 patients participated in the study. And researchers found that patients with type 2 diabetes who had been infected with COVID-19 showed significantly higher more fatigue when compared with patients who did not have COVID-19. So also, patients who had type 2 diabetes with previous COVID infection and had fatigue syndrome that was over 4 showed significantly higher inflammation markers during acute illness, and then also had lost more weight and reduced physical activity. So multiple studies suggest that optimal nutrition and physical activity in patients with diabetes who had been infected with COVID is a behavioral change that can reduce fatigue and other long COVID symptoms, and also decrease overall diabetes burden and onset. There was a study that evaluated 9 produce prescription programs in the U.S. They evaluated diet, food insecurity, cardiometabolic health outcomes in clinics serving low-income neighborhoods with or at risk for poor cardiometabolic health like diabetes. They found noticeable differences in A1C values in patients that participated in these produce prescription programs. So to give some background on what a produce prescription is, it is basically free incentives or money to purchase fruits and vegetables at grocery stores or farmers markets that are prescribed to you by your provider. So researchers found that A1C dropped from 0.3 percentage points with patients who had A1Cs over 6.5 and by 0.6 percentage points among those with uncontrolled diabetes, so anything over 8.0%. So studies suggest that this decrease in A1C value due to increased fruit and vegetable intake had about half the effects of commonly prescribed medications to manage blood sugar levels. So food in our community could be hard to access. However, there is a program called Market Match, which is a healthy food incentive program that can get you extra money at farmers markets to buy extra fruits and vegetables when you use your CalFresh benefits. If you have any questions about Market Match, the website will be in our description. But the Market Match program is funded through the California Nutrition Incentive Program. However, Governor Newsom proposed budget cuts threatening to end the Market Match program, which has been proven to provide increased access in low-income communities. If you are interested in learning more, please visit the Save Market Match website. So in closing, there are a few items that we can take away from this presentation. So periodic screenings add to your primary care provider for your diabetes. And also sustaining a healthy diet by eating fruits and vegetables, portion control, reducing consumption of fast food and foods high in fats and artificial sugars, really making sure that we're eating a healthy diet. Also just utilizing our nutrition resources in the community. So participating in Market Match to receive free money to buy fruits and vegetables. Also our Welcome Wednesday food distribution. And some local food pantries. And then finally, if you are a patient here at Roots, sign up for our diabetes self-management education support course, which is a 5-class series that focuses on building healthy lifestyle behaviors to successfully manage diabetes. So we go over topics on nutrition, diabetes medications, how to reduce low blood sugar episodes, and more. So if you are a patient struggling with diabetes, here at Roots, go ahead and let your doctor know. Other than that, thank you, Dr. Noha. I'll be passing it back to you.
Thank you, Vanessa, for all of that excellent information. I wanted to emphasize the point around advocating for benefits around healthy eating to remain in California. We know that the proposed budget has a number of cuts that threaten some of the progress that we've made in public health. All of that wastewater infrastructure that I mentioned in California is threatened, as well as a number of the investments that have been made to improve how we're able to respond to public health threats. So we will be talking about these things more and offering more ways to plug in and to advocate. So for now, to recap, if you don't know if you have diabetes, please find out. Check in with your doctor. See if you can get that hemoglobin A1C level checked as a screening. If you have diabetes already, then as always, you'll want to work to keep your blood sugar levels controlled, keep that A1C in the desirable range to reduce potential complications of diabetes itself, but also to reduce the risk of a bad outcome from COVID if you were to get COVID, flu if you were to get flu, and so on. You will also want to get other labs checked, like your kidney function test. This is something important to monitor when you have diabetes in general, because as I mentioned, it's a leading cause of kidney failure, but also because it may determine how we treat you if you do get COVID, which I'll talk about in a moment. And of course, you'll want to do what you can to avoid getting COVID in the first place, like we all should be doing, which includes all of the best practices that we know, and this includes getting vaccinated, as there is specific evidence that the risk of a bad COVID outcome for those with diabetes decreases for those who are vaccinated. Link to that studies in the post as well. So I certainly hope that all of our loved ones with diabetes are vaccinated and will keep up to date with the annual flu and the annual COVID vaccines. So if you or someone you care about has diabetes and has not been vaccinated, please maybe send them a link to this video. Maybe they can reconsider. If for whatever reason they did not want to get the mRNA vaccine, that's okay. Let's make sure they know that Novavax is another option for them. It's an older type of technology that we use on other vaccines, so some people may feel more comfortable with that. It is an option. Might take a little more looking into it to find out where it is available, but it is out there. Now, if you do have diabetes and you do catch COVID, you want to know as soon as possible, because diabetes is definitely one of those underlying conditions that make you eligible for treatment. So we want you to get tested and get treated in a timely fashion. So if you or anyone in your household has diabetes, make sure you keep tests on hand, or at least know where to access them. And we do have them available at Roots, both the PCR as well as the rapid test that you can also pick up if you are in the Bay Area. And as a reminder, here are our outpatient treatments for SARS-CoV-2. The number one choice for most people is going to be Paxlovid, which is available for ages 12 and up. If you have kidney disease, the dosage of Paxlovid may need to be adjusted. Once again, this is a conversation you want to have with your doctor in advance. The last thing we want is for you to get sick with COVID, call your doctor, and they say, "Oh, we haven't done your labs in years. We haven't seen you. I'm concerned about this or that, and now we're wasting valuable time to get you treated." So let's have a plan in advance, know where you stand. If your kidney function is more severe, you may need to go to the second line, which is remdesivir. Likewise, for little ones with diabetes, if they're under 12, remdesivir may be the treatment of choice for them. Remember, remdesivir is the IV treatment that's given 3 days in a row. It's very effective for this kind of early outpatient use to prevent things from progressing. So it will be important to have this conversation with your doctor in advance, or with your child's pediatrician in advance, so that you will have a treatment plan lined up and you will know where to get it, how to access it. And if you have diabetes and you've had COVID and you recovered, then make sure you're checking in regularly with your doctor, which you should be doing anyway. But especially post-COVID, because as we've said, diabetes can become more difficult to control after COVID infection. So we want to stay ahead of it, might need to adjust medications and so on. And if you don't have a primary care provider, please get one. Don't wait until you need one to try to find one. Know how to reach them before you need them. Establish a relationship with them, get your blood pressure checked, get those baseline labs checked, like cholesterol and that hemoglobin A1C, get the appropriate cancer screenings for your age and risk factors, know where you stand. Remember to eat a balanced diet, incorporate fresh foods, avoid sugary drinks and processed foods, get some regular physical activity unless you don't feel well. In that case, please get your rest. Manage your stress levels and get a good night's sleep. We will be taking next week off for the short week, the holiday week. And so this concludes our People's Health briefing, and we will see you again in 2 weeks, Tuesday at 10 a.m. See you then.